We've listened to the stories. We've heard about the rock bottom which some people have experienced as a result of severe multiple disadvantage. We're witnesses too, to the courage exercised by people committed to change, and to the sense of pride about what they've achieved. Celebrating stories like these is one part of our goal. But these stories are not just for witnessing. They call for wider change. To assist us with achieving this goal, we have sought further help from those who have told these stories, as well as others with lived and living experience of severe multiple disadvantage. They've identified areas in which they wish to see change. Let me mention the 5 they have highlighted to us as most important. My first recommendation is that the organisations in Nottinghamshire with responsibility for housing collaborate to develop joined-up, sustainable, long-term housing solutions which include appropriate support for people with severe multiple disadvantage. Housing First is one approach which provides a good example of this. It prioritises the provision of stable housing as a foundation for effective support. Mansfield is one place where you can see the approach being put into practice. The programme there has significantly reduced the number of people rough sleeping and has enabled more people to access key services, such as those for people whose use of alcohol or drugs is harmful. My second recommendation is about equipping frontline workers to recognise how trauma can influence behaviour and how they can adapt their practice. This is important because we were reminded that people living with severe multiple disadvantage have often experienced multiple complex traumas, which can influence the way they engage and interact with services. So I'm recommending that the Health and Wellbeing Board sponsors the development of a framework which health and care organisations and other public services in Nottinghamshire can use to implement trauma-informed care. We've also heard of the barriers and additional personal difficulties created when people have to repeat their stories to a succession of services or workers. So my third recommendation is that services for people experiencing severe multiple disadvantage should make arrangements to ensure that a person's story is appropriately shared with the other services supporting that individual. In anticipation of further work in the county on clinical pathways for people experiencing severe multiple disadvantage, I recommend that the group who will oversee this work should work with frontline professionals to understand the barriers to sharing stories appropriately and create the infrastructure and culture to ensure that this sharing becomes routine. My fourth recommendation is that the Nottinghamshire Health and Wellbeing Board sponsors work to co-produce guidance for partner organisations about the use of strength-based, recovery-oriented language, in line with the guidance from the National Institute for Health and Care Excellence. We have heard from people with lived experience that use of language which stigmatises simply adds to the barriers which prevent access to services and support. We also know that careful use of language can help correct the damaging misunderstanding that severe multiple disadvantage is a lifestyle choice. There are 2 halves to my final recommendation. Both halves reflect the fact that co-production is important to increase the future impact of our services, and that it involves a significant commitment of time, energy and insights by people with lived experience. Valuing this and undertaking co-production in a way which is sustainable for people with lived experience is essential. So, addressing myself first to my team at Nottinghamshire County Council, we must help create a network of relevant co-production groups so that the influence of people with lived experience can be sustained and strengthened across a range of public health commissioned services. Turning secondly to our partner organisations in the integrated care system, who, together with Nottinghamshire County Council, have already stated their commitment to co-production. The service plans of directors and their service leads should address how co-production involving people with severe multiple disadvantage is embedded in service development planning and underpinned by arrangements which are sustainable for those involved. This would ensure the influence of people with lived experience is felt across all services. If any of these recommendations sound familiar, please ask yourself what more you need to do to deliver that change, and whose support do you need to secure to make that happen with people in Nottinghamshire. If you'd like more information about severe multiple disadvantage and a glossary of terms, please see the PDF linked on this webpage. And for further information on support services available in Nottinghamshire, please also see this document. A final word of thanks to all those involved in this co-produced report, to members of my team, but more particularly to the people with lived experience who have shared their insights and shaped these recommendations. And now, how shall we respond?